Excited na ba tayo para sa ating susunod na hero speaker? Congratulations once again. Moving on to our third hero. Our hero is a licensed pharmacist. She graduated BS Pharmacy at University of Santo Tomas. She then continued her education and graduated Doctor of Medicine at Far Eastern University, Dr. Nicanor Reyes Medical Foundation. She finished her residency training in obstetrics and gynecology in Cardinal Santos Medical Center, then completed her fellowship training in reproductive endocrinology and infertility at the FEU NRMF and Jose Reyes Memorial Medical Center Consortium. Currently, she is the Vice President of the Marasigan Valley Medical Society and the Philippine Obstetrical and Gynecological Society, Metro Rizal Chapter. She is affiliated with various hospitals such as Marasigan Valley Medical, Fatima University, Antipolo, Metro Antipolo Hospital Medical Center, Pasig Doctors Medical Center, and Cardinal Santos Medical Center. Can't wait to learn more about her experience during this pandemic on how she was able to accomplish her mission being a doctor. Let us give a virtual welcome to Dr. Gilyn Marasigan.
Best thing about being a doctor?
The best thing to be an obstetrician gynecologist is when you get the sense of fulfillment, bringing forth new life. And when you see your patient smiling after a successful surgery, those are my happiness. I could feel the sense of fulfillment when I see my patients deliver successfully.
Nice. So tama ba, Doc, you journey as well with your patient? Because, di ba, from the time na yun, na-diagnose natin sila.
That's true. So, pregnancy is a journey. No, for 9 months, you get to see the patient every month for their checkups. But in this time of pandemic, nabawasan na yun. No, so you also do teleconsult, and then you see them not so often. So you see them on the first trimester, and then one in the second trimester, you give requests for ultrasounds and laboratory exams. And then weekly na, no? Pagka it's time for them to deliver.
So yun pala yung difference ngayon. Kapag nabuntis ka during the pandemic, no, tinatawag nila pandemic baby, yun, medyo hindi ganun kadalas yung physical check-up. Pero meron pa rin online teleconsultant.
Yes, that's true. We do teleconsult. No, so they report to me if they have excessive vomiting or uterine contractions, bleeding. So those are the warning signs.
So you say, Doc, na ano ka pa rin talaga? On-call ka pa rin talaga in terms of medyo demanding pa rin yung work mo as of now.
Yes, that's right. I get referrals because I deliver COVID patients, no, even pregnant ones yes, I have a lot of referrals. I deliver COVID patients and I attend to them. I deliver, COVID patients. Not all obstetricians deliver patients with COVID. So some of the obstetricians here in Marikina refer to me those patients.
So talagang napakatapang ni Doc, really, because she's putting her health on the line with as well, because she's handling COVID.
Yes, actually, my mom stopped her practice. No, as I've said, she's an obstetrician gynecologist as well. So I get to deliver her patients too and some of the obstetrician gynecologists here in Marikina.
Kaya napaka-swerte naman natin that Doc Gilyn gave her time with us. Yan, nabanggit mo na ito yung ginagawa mo ngayon during time of pandemic. And I'm just thinking mo yung mga challenges na in-encounter mo ngayon being a doctor. I'm seeing mga videos of doctors na walang tulog, walang tamang rest and pagkain. Is that true? Is that something that you also experience right now?
That's true, no? Hindi sa amin yung time namin actually, especially the obstetrician gynecologist. We are on call palagi. The difficult part is when I look for a hospital who caters COVID patients. They get to, when they get into labor and they are COVID positive, I call hospitals who cater COVID positive patients. Actually, our hospitals were full, kaya nahirapan ako na humanap ng hospital sometimes.
Yeah. So yun pala yung pinaka-struggle dahil nga sobrang madaming cases, no? So yun nga, no? So paano kung gano'n na wala nang mahanap na open na hospital? What are your options na binibigay sa inyong mga patients?
We also refer them to a government hospital. Sometimes they also cater COVID patients. Not all, no? Kasi syempre, puno na talaga around. Minsan, lumalabas talaga ng Marikina just to have a hospital where to deliver. No? Sometimes I get to call friends from other hospitals para ma-accommodate yung mga patients with COVID.
Okay. How about you, Doc? Kamusta ka naman? How are you taking care of yourself right now? Meron ka ba bang day off?
Oo, meron naman.
Meron na.
Ang totoo niyan, I invested in PAPR already. The PAPR is yung parang astronaut ka, no? Para meron kang protective equipment for COVID virus. Kasi syempre, frontliners, no? Dapat talaga meron kaming protective covering or equipments. So, there, yeah.
Okay. Apart from during work, you're taking care of yourself, you're making sure na safe ka din. During your off days, ano naman yung ginagawa mo to keep yourself healthy, to keep yourself in the right mind and state, emotional state? Ano ginagawa mo? Can you share to us?
Yes, I do workouts, no? 3 to 4 times in a week, and then I get to spend time with my daughter. She's 13 years old, no? Bonding time pag wala ko sa work. And I do what I love. I also play the piano, do some paintings, and then chat with friends, yeah.
Ayun. So, normal na tao naman pala si Doc. Ginagawa ko sa mga ginagawa din ng tao kasi minsan akala natin, no, puro work na lang sila sa mga ganyang klase. And I think that is really important na meron balance, no, Doc, na in terms of...
Lalo na ngayon, in these trying times, no, talagang being positive, it's so hard. Kasi lagi tayong down. Sometimes, ang advice ko is not to watch news na, no, na nakikita natin, the cases of COVID are increasing. You just do what you love, and then also think about your whys. Why do you do those things? Why do you do your work? Every one of us, each one of us is considered a frontliner, no? Considered a hero. Kumbaga, just do a service to other people, no? The moment you wake up in the morning, decide to be of service to God and His people, no?
Ang ganda nung sinabi ni Doc that every one of us here has a part to take in terms of making sure that everyone will be safe, no? So, wag po tayong pasaway. Sinabi ko pag lumabas, huwag naman kung kailangan lumabas. Para, di ba, hindi mahirapan ng mga katulad nila, Doc, they had to treat people with COVID. Okay, guys, baka may questions kayo. Just put it in the comment section. This is a great opportunity na magtanong kay Doc when it comes to her specialty, yung kanyang specialization and expertise. Sabi nga ni Kathleen Joy Ramirez, yes po, bawal ang pasaway. Ngayon ba, Doc, mas marami, because since marami ang working from home, marami talaga ang mga couples na they are staying at home. Tumaas din ba ang chances na maraming mabuntis ngayon?
That's true. Ang daming COVID babies. Some of my patients, they text me and then deliver the good news. They're already pregnant. Kasi siguro mas relax na. They're all together inside the house. And then mas relax, mas nagkakaroon ng pregnancy. Tapos they also do their workup pag may plans talaga to undergo fertility workups. No, this is the time na na ginagawa nila yung workup nila. Kasi magkasama na sila and work from home.
It's good news. Nako, excited na akong ma-meet si Doc. Magpa-consult din sa kanya. Kasi that's also my prayer na workout din namin ng husband ko. So kami, Doc, ng husband ko, we're married na for 6 years, turning 7 in July. So, wala pa kaming baby. And,
I advise you undergo workup.
Yes. Medyo nagpa-consult na rin kami before sa fertility specialist. We need to seek another opinion. Any questions from our viewers? Huwag kayo mahiya na magtanong kay Doc. Doc, nakapag-travel ka na ba? Given this
No,
time?
not yet. No.
Not yet. So, if I were to ask you, do your family travel together? What's that dream destination that you have in mind if we are already allowed to travel?
Yes, we do travel twice a year. Sometimes local, sometimes international. Dream travel would be Japan, no? Yeah. Hindi pa ako nakakapunta dun actually. But yeah.
Where specifically in Japan?
Tokyo.
Yeah,
Tokyo.
Food
trip, no?
May license ba yan?
Yes. Pero siguro matatagalan pa yan.
Food trip, no? So, meantime, muna tayo? Makontenta muna tayo sa panonood sa YouTube, saka sa Netflix ng mga
movies. That's true.
Ikaw, if you have this vision, sa tingin mo, where you're seeing right now in our situation in the Philippines, mga ilang years pa kaya ang abutin na finally we can not really say go back to the normal but have that kind of lifestyle na pwede nang lumabas, travel and all that. Ikaw?
Vaccination is going. I think about 2 years. We could already go out, do what we love. No? Tsaka yung behavior din ng mga tao na kung talaga magtuloy-tuloy, you always wear your mask and your face shield, talagang pwedeng in 2 to 3 years we could already do travel and do what we love. Yung nakakalabas na talaga even the elders and the kids, no? Mm-hmm. Na pwede na sila din na mag face-to-face sa school. Basta lang tayo. Sa mga hindi pa dyan nakakapa-vaccinate, I advise talaga do vaccinate to be protected.
Oo nga, Doc, kasi marami pa rin yata naniniwala na hindi pa tamang magpa-vaccine right now. Anong sinasabi mo sa mga tao ganun?
Actually, kahit pregnant, no, pwede nang mag-vaccinate ngayon. So talagang lahat recommended na ma-vaccinate. Hindi pinapromise na hindi ka na magkakaroon ng COVID, but pinapromise niya no severe symptoms. So yun yung mga promise naman ng vaccination. More on benefit siya na versus the risk, kumbaga. So do vaccinate, no? Para lahat na tayo ma-achieve na natin yung herd immunity.
May tanong si Kathleen Joy Ramirez, kahit po ba may asthma, pwede magpa-vaccine?
Yes, kahit may asthma, pwedeng ma-vaccine. Pag na-injection ka na, na-vaccinate ka na, sometimes may allergic reaction, but i-monitor ka naman after the vaccine. So you will get to stay there about 30 minutes to 1 hour para makita kung nagkakaroon ng mga allergic reactions. Pero kahit may asthma, yes, pwedeng ma-vaccinate. lalo na may comorbids siya, which is the asthma. Talagang dapat na ma-vaccinate siya.
Oo, kasi yung risk of getting COVID, and then sabi naman nila, tama Doc, no? Even if na-vaccine ka na, you can be still susceptible to getting COVID. But
Yes, that's true.
Yung risk na malala yung mangyari sa'yo is lesser. Tama po.
Yes. Pag na-vaccinate ka na and then you get COVID, pwedeng mild symptoms lang. No? Hindi na siya abot sa moderate and severe. So, hindi naman pinapromise ng vaccine na 100% hindi na magkakaroon ng COVID, but mild symptoms lang yun.
Okay. May tanong si Christine. Buen viaje, Doc. Gaano kahirap ang setup ng OR ngayon as compared before pre-pandemic? Mahirap bang magsuot ang magtanggal ng mga full PPE?
Naku, sobrang hirap talaga, tsaka matagal siya. Magsuot ng full PPE. We have this level 1, level 2, 3, and 4. When we find out na meron talagang COVID confirm yung patient, level 4 kami. No? Talagang mainit pag naka-PPE. Salute to the nurses kasi talagang hours sila na naka-full PPE, lalo na yung mga nasa ward na nurses. Kami, when we do ORs lang, 2 to 3 hours lang. Pero hirap na, what more yung mga nurses natin. Ang OR setup ngayon, before we do surgeries, RT-PCR muna. Dapat maswab muna kasi mahirapan yung recovery ng patients if COVID positive sila. So before operation, RT-PCR na muna. And then, of course, lahat naka-PPE inside the operating room. Unlike before, naka-scrub suit lang talaga kami.
Yan. Thank you po, Doc. Yan. Sabi ni Kathleen, yung kapitbahay po kasi namin natatakot po siyang magpa-vaccine kasi may asthma siya. Kaya pala yun natanong.
Okay. I suggest you get to speak with your doctor para mag-advise din sa'yo ng mas maganda or ma-explain sa'yo ng mabuti kung ano yung mga benefits ng vaccine. No? Kahit na may asthma, huwag matakot. Huwag matakot magpa-vaccine.
Okay. Sabi nga ni Kathleen, salute ko sa inyong lahat na frontliner. Wow, ang ganda. Ang sarap ng kwentuhan natin ni Doc Gilyn, and I'm sure naging interested ang mga tao. No? So please invite them, Doc, sa iyong mga clinic. No? So para they could visit you and do a consultation. Teleconsult, diba? Available naman po kayo.
Yes. When you visit the Marikina Valley Medical Center website and then click on virtual care, you can look for my name and book an appointment. And then you can also find me in Metro Antipolo Medical Center along Marcos Highway, Antipolo, and Pasig Doctors Medical Center along Manggahan, E. Rodriguez Street, and Fatima University Medical Center, Antipolo. And also Cardinal Santos Medical Center along Wilson Street, Green Hills. Yeah.
Ayan. So, ang dami pala ni Doc na mga ospital na pwede siyang puntahan. Okay. Sige. So, final message mo, Doc, sa ating mga viewers right now, especially yung mga nagdadalawang isip if they still have to consult a doctor at this time, no, planning to have a baby and all that. So, what's your message for them? To uplift themselves during these trying times.
Do what you love, no? Go back always on your whys. Why do you do your job, and why you are there to impart your skills and talents, no? Do your routines, and also seek the help of your doctor and ask them if you have any comorbidities or any hesitancy para ma-vaccinate, no? You do seek consult with doctors. Huwag matakot, huwag mahiya. laging andyan yung mga doctors para mag-explain, no? Para rin naman sa health natin yun. So, pwede naman mag-consult sa mga doctors.
Saludo tayo kay Doc Gilyn for sharing to us her journey during this pandemic. Okay, you may be wondering, asan kaya si Doc Gilyn? Bakit interview namin yung pinalabas? Doctor on call. Siyempre, pagka doctor on call, siyempre may priority. Kailangan i-priority yung mga taong may sakit and tao na kailangan ng pag-aaruga ng isang doktor. So let's pray for Dr. Gilyn that she's safe and sound so that she'll be able to continue her mission of helping people during this time of pandemic. Ayan, maraming salamat for that very meaningful interview. Okay, now we're already down to our last hero. But before that, before we proceed to our next hero, we would like to thank our sponsors.